Hi, my name is Brandy Butcher. I'm going to be doing Activity 8, Regulatory Environment for SIM 440 for American Sentinel University SIMPath program. With this activity, I will evaluate how healthcare exchanges can change the concept of outpatient treatment, explain the advantage and disadvantage of embedding practice guidelines and clinical pathways into the electronic medical record, describe demand management and how it increases consumer involvement, and compare and contrast disease management and case management. So, health insurance exchange is also known as a health marketplace. It's a shopping center basically for comparing health insurances, and this came about with Obamacare. All insurances through the healthcare exchange have to cover outpatient services, emergency services, hospitalization, laboratory services, preventative care, and several other things. Healthcare exchange can drastically change outpatient treatment. Ambulatory care is on the rise, not only from the consumer but also from the payer. Outpatient services cost less, and most patients feel like they have a better service quality from the outpatient center. On average, costs can be 30 to 40% lower according to McKinsey and Company. According to the NCBI, clinical practice guidelines are statements to assist the practitioner about appropriate healthcare specific clinical circumstances. They contain recommendations that are based on evidence from systemic review. They are not set in stone, like it can be customized to or adjusted as needed to the patient that you have in front of you. It's just a guide that uses evidence-based practice to help get the care that the patient needs. The advantages to the embedding it into the electronic medical record would be having the latest and most effective plan readily available for the patient. Also, it can help clinicians to be all on the same page, following the same treatment plan. That way, if you go from the hospital to your primary care doctor, they can see the same plan that they've kind of initiated in the hospital and they would like for you to follow. So this way, all providers will be on the same page. As far as the disadvantages, some providers feel that they are going to lose their autonomy by only having these select things to pick from. And then also it's very expensive to incorporate it into your system if you don't already have it. Demand management is a process of empowering patients to make wiser healthcare decisions. It focuses on wellness, health promotion, prevention, and early detection. This way the physician is able to work directly with the patient and on how to make better choices for their health care. And how to change their lifestyle to avoid and prevent chronic illnesses. So basically it works on the patient themselves, with the patient, prior to having any severe or chronic illnesses. So if a patient is overweight and they don't have any other illnesses, like they don't have diabetes and they don't have high blood pressure, things like that, it gives the provider and the patient a chance to work together to come up with a plan to try to decrease their weight before they end up with having all of those other diseases that come with being overweight. Disease management and case management are both useful tools in healthcare. According to the AJMC, disease management focuses on improving the quality of care for people that have chronic illnesses, trying to promote preventative care and avoid hospitalizations. It's not tailored to any one patient. It's more of a broad spectrum that focuses on the disease as a whole. Whereas case management works to improve the quality of the patient experience by coordinating hospital care. Case management is different. It'll be customized to each patient. They will work directly with you to come up with a plan that would benefit you specifically. It'll help you. So if you're in a hospital, they can help you set up outpatient services. If you need medical equipment, they can help you set that up. So these are tailored toward what you need, not so much a certain disease. Thank you so much.